Hello, everyone. How are you? Thank you for joining us again this evening. We have another great topic to talk about tonight. It's one of Cam's favourite topics, obesity. Lots of different words for it. As we were just saying, you don't want to say words that would upset people or upset your dog if they hear you calling them obese or fat, but it is a really big issue, and especially in arthritis. And we're going to talk about that this evening with lovely Caroline. She has come on to talk to us about what she does. She runs a company called the Slim Pet Vet. Difficult to say that. I thought it was going to come out wrong, but Slim Pet Vet, and I'm going to get her to talk to us about that. It's all about getting dogs to lose weight, to be a healthy weight, and she's going to discuss what that means. So before I introduce her properly, I'm just going to play you our little ad from Big Barker, just to say thank you so much to them again for sponsoring our lives, and in conjunction with weight loss and all the other things that we can do for arthritic dogs. A really comfortable bed is going to help with their sleeping. If dogs are sleeping well, and they're going to rest well, and they're going to feel better, and they'll exercise better, and just generally be more comfortable if they're resting well as well. So these Big Barker beds are superb for that, and we love them at camp, as you all know if you've seen one of our lives before. So thank you to them. So if I can pass on to you, Caroline, would you please give us a little introduction about what you do and a little bit about Slim Pet Vet?
So I'm Caroline Taylor, or Dr. Caroline, the Slim Pet Vet, and for the last year and a half or so, I've been running a Facebook page called Slimline Canine. I started it off during lockdown because I was helping a lot of my patients. Because I couldn't see them in the clinic, I was giving them some support and some online help with slimming down their pets and slimming down their dogs online. So I sort of took that because I thought there's probably quite a lot of people out there who don't recognize. We'll talk a bit about body condition score later on, and they don't necessarily recognize that their dog is overweight and those impacts that it can have, particularly in the later years, risks of disease and things like that. I'm a first opinion vet in the UK. I do some other bits and bobs and do some demonstrating of ultrasound and laser machines, and that's where my interest really in controlling weight. You know, I mean, just like you, Nicki, you've seen that rise of the number of animals that are overweight, and it's shocking now to think that even dogs as young as a year, around over a third, 37% are thought to be over their ideal body weight. So
at such a young age, it's really bad.
Such a young age, and I'll talk about young dogs in particular and why that is such a sort of, we know already. I think the latest stats are now 60% of dogs in the UK are overweight or obese. But you know. And really, particularly if your dog has arthritis or is at risk of arthritis, that's what we'll sort of go into today, really, and how significant that, in particular, to manage arthritis, but there's lots of other diseases as well, in particular diabetes and heart disease and breathing issues. You know, your dog is more at risk of overheating with this heat wave coming here in the UK. They're more at risk of having anaesthesia if they're overweight, because of the anaesthetic drugs that we have sort of accumulate in fat. So their recovery period can be a lot longer. They need a higher dose of the medication because they're heavier. We work it out in veterinary medicine on terms of a mix per kg, number of milligrams per kilogram. So if they're heavier, they need more to get the same effect. But unfortunately, that sort of stays in their body a little bit longer as well. So it can take them a lot longer to recover.
You do really notice that. Yeah.
And sometimes the other way, because I don't know about you, but greyhounds always seem to be up and about and, you know, and it was with the race horses as well. When I used to work with horses, they were always, you know, really challenging to understand.
Yeah. I mean, it's definitely things you don't really think about when, as an owner, you don't think that it's going to impact that kind of thing. You know, even having an anaesthetic, it's going to make a difference. And I think, you know, that's one of the things that we talk about in planned surgery, so things that we can maybe postpone if possible. I've definitely had a few surgeries, maybe bitch space, for example, where we've said that it's going to be much, much safer for your dog, and the anaesthetic is going to be a lot better if we get that weight off first.
Yeah,
so it's really important.
It's really, I know, it's really interesting actually, because from a vet point of view, you definitely think, oh well, let's get this weight down first, and then we'll do the surgery because it will be a lot safer. But having spoken to lots of owners, it's actually not a great incentive for an owner to get their dog to lose weight, because
Really?
they're thinking, oh well, I don't really want my dog to go into surgery. And,
so then they just don't do it.
So actually, if they can, and it might not be an actual conscious thing, but actually in the back of their mind, they're thinking, oh well, as soon as I get him to lose weight, that's it. He's going to have to. I'm going to.
It's a good point.
One, pay for the surgery. Two, I'm going to have to be up all night worrying about it for a week.
Yeah.
And so. Actually, I know for us, and from the veterinary point of view, it's like, oh well, why wouldn't an owner want to reduce their risk? But risk is a very difficult concept, and obviously risk of long-term disease is sort of all way out there in the future, but risk of a surgery that I'm going to have soon, let's do anything we can to delay it. And so that actually, even though I always think it's funny when vets are pulling their hair out. Why aren't they? Why isn't something happening? We need to get this dog. But actually, that is not necessarily a better incentive. Would be actually, do you know your dog might not need the surgery if they can lose 5 kilos?
Yeah.
That's the kind of incentive that you go, oh wow, well if I have to take them swimming once a week for the next 3 months, maybe their legs are going to get that much stronger and they're not going to need the surgery. And so maybe we should sort of be changing what we think of terms of
what owners would want,
what when we're actually from the dog
side of
view.
I mean, I think that's a good point actually to start with. When we talk about arthritis in particular and medications, a lot of people now, they don't want their dogs on lots of medications for various reasons. And that would be one of the reasons to say, look, if we can get them to lose 10% of their body weight, we might be able to reduce those medications, because that's going to make a bigger impact, or is going to make an impact on the dog's arthritis.
It's we've done it the wrong way around now, because as little as 6%, even 8%. They've done studies on subjective and objective studies looking at weight loss and what impact that has on subjective measures of lameness. And 6% reduce, even just 6% of weight loss. So if your dog needs to be, say, 20 kilos, but it's 25, they just would need to lose, 20 a kilo or less than a kilo. That would impact on the appearance of lameness. And we know that actually that is true for objective measures. So that's when you're looking at kinetic movement analysis and gait analysis and things like that.
Measurements.
That is reduced just with 8% of weight loss. So I think this whole, they're this much overweight, I'll never get them to their ideal weight. Actually, just a little bit of weight loss, even if it's that ongoing, even if they put that weight on again, they probably, if you're here and then you lose that weight, you're then going to, even if they gain weight again, they're starting at a lower level than if they never even tried, and they'll just continue to gain weight. So
I think it's the same with people, isn't it? If they can lose, you can have a target weight, but actually as soon as you start losing, you are improving your quality of life and the way you function. So even the beginning of the journey is already going to have an impact, which is amazing, really. And so do you want to, should we pop up some of your slides?
I've got some really interesting data here. Now let me just see if I can.
I'm just going to read out a comment from Lynn, who is one of our ambassadors. She was just saying here that I find that taking Kai for his Librela injection each month means that we can monitor his weight effectively. During lockdown, it was really hard to do so, which was one of the reasons that you kind of set up what you were doing, is because during lockdown, you weren't able to really have those face-to-face conversations in the practice with people. So doing it online, although you couldn't necessarily weigh the dog when you're doing it online, it was still having that face-to-face conversation about it, wasn't it? And planning.
Yeah, exactly that. And actually sometimes, it takes that, it can be quite a nerve-wracking, we forget it can be not quite a nerve-wracking experience for the owner, but also for the dog, having to be dragged in and made to sit there on the scales, and there's a lot of other dogs barking and they don't know where, particularly, obviously in lockdown when, no one can come into the practice.
Yeah.
And then it's sort of everything hangs on that. Oh, have they gained? Have they lost? And, it feels like a bit of a, lose-lose situation, because even maybe they're the same, even though you've been trying really hard. But, those sometimes the monitoring is something that there's other ways we can monitor as well. And that's what I found. You can monitor things like, waist measurement or chest measurement, or, weigh them elsewhere, somewhere where they're perhaps more, like to go, maybe the pool, or, if you're going to the pet shop or something like that. Or, if they're small enough, if they're under 20 kilos, then normally you can carry them
and hold them on your own scales, or
your arms. It used to be the Wii Fit, where you could stand on it, and then it would be like, oh, are you holding a pet? And we're like, no, I've just had a big dinner. Have you ever had that? But it would automatically weigh, tell you what your pet's weight was.
That's really clever.
You what weight you were. But you can do it that way. Obviously a bit more difficult for dogs, large breed dogs. And there's always that worry that, have they been are the scales accurate? Have they been are we making sure that they're
calibrated, and
they're calibrated and all of that. So hopefully you can see these slides.
Right, so popped you up there. Yeah, I was just going to say, Lynn, for those dogs that do adore going to the vets, then I agree. I love it when the dogs come in, maybe now that we are doing the Librela injections monthly and these arthritic dogs come in, it is a really good thing just so we have got those weights. But even if you're not coming in, it's worthwhile doing at home on a monthly basis as well. But we can talk about later about your recommendations about how often to weigh and documenting it and things like that.
Yeah, I think it is, like you say, just something really, it's a really useful record to have, because sometimes weight loss can be a significant sign of disease as well, weight loss, that you wouldn't necessarily know, as well as weight gain, so it would be a bit of a red flag, particularly, if they're on long-term non-steroidals. Do we need to do, a blood test to check the kidneys if there's been some unexplained weight loss, or weight gain, and those sorts of things. So
definitely. So we can see your slide now. So why is obesity so important, and why is it so hard to tackle?
Yeah, so we can go through, this is the structure, and it'd probably be about sort of 20-30 minutes, depending on how fast I talk. And please, happy to take questions as we go through, as things come up, or at the end as well. We can have a discussion. It is quite odd because I can't see the questions.
I would keep an eye on them. If anyone has anything, then and it's sort of relevant to what we're talking about when you're going through, I'll pop them up and we can share those.
Yeah, and we'll talk about what impact being overweight has on activity level, and specifically the impact on the joints, and then go on to why it can be so hard to tackle, and whether it is worth doing it. So a little bit of background. I'm Caroline Taylor, otherwise known as Dr. Caroline, the Slim Pet Vet. So you'll find my free Facebook group here. A really happy, welcoming, warm group for dog-loving people. And even, if you're, your dog isn't overweight, but you want those tips and tricks, then that's the place to go. Obviously, I will do personalised consults for food calorie calculations and recommendations. I'm not actually a veterinary nutritionist, and so I don't per se do home cooked foods,
Mm-hmm.
particularly for weight loss. Home cooking is difficult anyway.
Yeah.
There are obviously, we've got websites to
Nutrition.
recommend in terms of balancing foods and that sort of thing. But I specialize more in that whole body, it's not just about the food.
No.
But obviously that is a big part of and it's often, dogs that have got, food sensitivities, they can't have chicken, say, so a lot of prescription diets may not be suitable. So, we look at what alternatives that are available that are still going to be effective. And then there's obviously the website there with there are some videos there on body condition scoring, and you can look on there and join when you're ready.
I'll put the link to the website in that Facebook group in our blurb.
So first of all, is my dog overweight? And this is Merlin, who's with me, who's answers on the back of a postcard what breed he is, because he's a bit of a rare breed. So
there's a bit of Springer in there, and a little bit of, I don't know what's going on with your foot. Oh, I don't know. What is he?
I'll leave that till the end. He is actually a breed rather than
okay. Okay.
So body condition score is a better estimate really of healthy weight than just looking on the scales, and even like breed charts, especially now we've got so many crossbreeds, it's a bit difficult to know, what they should be. Males and females can be quite different. So another thing you can look at is what your dog's weight was either around 1 year, 1.5 years of age, or just after neutering, which is usually about the same. That's if you've got a history of where they were then, and that normally is quite a good estimate of what their ideal body weight should be, just at the end of their growth phase, before they had any middle age spread or anything like that. It's not really appropriate to ask on a random Facebook group, my vet said the dog was fat, what do you all think? Because 60% of those people on the dog groups, if you look at the stats, 60% are probably going to have dogs that are overweight. So, and again, looking around at the park, it's a bit like, looking around, at the human population. Unfortunately, it's not necessarily, what you see, what is normal is not necessarily healthy. No. Particularly if your dog's at risk of arthritis. So body condition score is something you can learn to do at home. It is much more difficult to learn to do it on your own dog, I would warn you, than practicing on other people's dogs. So I do a body condition score sort of, little a stream every month to give people incentive to keep a check on it, but two, to almost practice looking at other dogs and see what body condition they are. And it is more difficult to just do it from a photo, particularly if that photo is just a dog lying on the sofa. You really need to have them. What body condition score is this? You have to have them sort of sideways on, and then from above, you have to take a picture that way so you can see whether there's a waist and an abdominal tuck. So like this picture here, this is the body condition score chart from the World Small Animal Veterinary Association. And what I like about this chart, there are lots of other charts available, often, made by different food companies. Some of them are actually breed related. You have small, medium, or large breed, or there's certain ones for pugs or brachycephalics as well, because they might well carry their weight in a slightly different place. But these are the sort of pictures you would have to have of your dog from the side and then from above. And this is actually a normal body weight here, 5, or
just
even
about
4 or 5. So you want to be able to see that waist coming in. You want to be able to see a tuck from the side, and you want to be able to feel the ribs. So you should be able to feel them, and you can still see me, can't you?
Yes.
So if you feel your this is known as the knuckle test, where you sort of feel your knuckles. That would be a bit too thin.
Yep.
That's if your knuckles are flat and you can feel your dog's ribs like this, that's about right.
Yep.
if you turn your hand over and feel that side, like
That's
you
too
can't
much.
really feel, there's a little bit too much there. And if it's more like here in the middle of your arm, yeah, that's more like, you know, 7, 8, 9 out of 9. So even at 7 out of 9 body condition score, the ribs, you can still feel them. Palpable means you can feel them with difficulty. There's a heavy fat cover, noticeable fat deposits over the lumbar area. So that's around here, around the tail head sometimes. You can sometimes still see a waist, but it might be very difficult to make out. And the tuck is normally still there. So that's at 7 out of 9. So that's still, you can see an abdominal tuck. But and then if they're sort of more just all over round, that's when you're looking at sort of 8, 9 out of 9. And if you think about these correspond to 6 is about 10% over their ideal weight, 7 is around 20. 8 is around 30% over their ideal weight. So, and they can be, you know, 40 or 50% over their ideal weight. So it's a lot of extra that they're carrying. So if you just think of all that extra tissue, all that extra wear and tear, and I think you've talked before with people talking more on a sort of biomechanical side, but you know, that can infiltrate into the muscles and into the tendons, and so that can sort of weaken the strength around the joints and things like that. That's, you know, that's sort of the mechanical
one of the impacts,
which I'll go on to. This is a chart that I found. I was doing some research into activity monitors for dogs. Fitbar, one of those. There's other ones. There's PitPat is often very popular in the UK as well. Now the ones just like an Apple Watch or you know, a Fitbit. Oops.
So these are things that you attach to either the harness or somewhere on the dog, isn't it? That then when they're outside, you can track how many, well, whatever measurements the activity tracker is going to do it in.
Exactly what measurements it does. And this one, for instance, they have 0 to 8K. This isn't kilometers. It's just they have this chart called bark points. So this is a normally active dog with no medical conditions, and they're looking at thousands and thousands of different dogs here, and they've actually collected this data and put it together. So it's sort of big data. It's not an official research published, but they are working with different universities around the world. I think it's actually an American company, but I think they do some work with Glasgow and Cambridge in the UK to delve into some of this data that's produced. So this is no medical conditions in the blue. Orange is if they're overweight. Grey is if they have allergies, and I was quite surprised to see this impact on activity level with, you know, skin disease or allergies there. And then in the dark grey, you've got arthritis here at the bottom, which, you know, on average, looking at these, you know, thousands of dogs that they've got data for, arthritis is the biggest thing that impacts on activity level, which, you know, is not a surprise. But
imagine that if you have obesity and arthritis together.
Exactly.
Even further.
Is that, you know, potentially, is that going to reduce it even further? Or you know, is this, you know, the fact of being overweight is impacting on activity level, and then, you know, when you add in arthritis as well, that's going to decrease, and it's a bit of a vicious circle, isn't it? Because then, you know, weight gain might continue to go up if you're not burning off the same number of calories. There is another chart we've got here. It might be a bit too busy with looking on here. They've sort of broken it down into different sizes of dogs. So you've got 0 to 20 pounds here, so 0 to 10 kilos, about thereabouts, and then sort of 10 to 25 kilos, and then 25 to 40 kilos here, and then 40 kilos plus, so large breed dogs here. And not surprisingly, in large breed dogs, it probably impacts on activity. In general, their activity level is less anyway.
Yes.
You know, smaller dogs are much more active, or at least the acceleratometer that's in these fitness trackers is showing a lot more activity level.
But
you've got, there's then some, which has actually, interestingly, dogs between the size of 25 and 40 kilos, actually being overweight has the biggest impact on their activity level compared to arthritis, which is interesting.
Yeah, weird, that one, isn't it?
Yeah. So yeah, but it's across the board. These medical conditions can have, significant impact, and unfortunately, if your dog is less active, then that, it's a bit like what came first. Was it overweight and then it got more active, or was this, less active led them to be overweight? Obviously, this is just the data. It doesn't actually show cause and effect.
No, but they could then delve deeper into that and then find out more.
Yeah, but you can look there. If you look, there's lots of other studies there as well on the FitBark website. I think if we go back,
Lynn's written here. It would be interesting to see how dogs with optimal pain control, so arthritic dogs on medication or hydro or whatever else they're on, fare in comparison to those with arthritis, basically untreated dogs, I suppose.
Exactly. Yeah, exactly. Well, it's not clear whether these are treated or whether they are. It's just like you say, that very sort of basic. But there's lots of other really interesting. The impact of fireworks on behaviour in terms of activity levels. There's different calorie counters based on. These are not so clear to understand because they don't have a sort of basic activity level. They have these bark points, and that can be more difficult to sort of then relate to. Oh well, what does that mean my dog needs calorie wise? But yeah, it's definitely worth sort of looking into and seeing what's there.
Hannah's also written, and I think Hannah's written, it would also be interesting to know how much is the dog limiting the activity versus the owner. And I'm assuming that these are all trackers on dogs that are off lead and doing what they want, but we don't know for sure.
No, that's true. And it really interesting point there, actually, because what some of the people I've worked with, if your dog has had or is suffering from arthritis or has had an injury, you're almost quite reluctant to actually walk and exercise them at all because you don't want them to have another problem again. But obviously, in people, gentle, walking exercise is actually really beneficial, not only for general health, but also for sort of mental health and, those endorphins you get after exercise. So obviously, I'm not suggesting forced exercise for dogs that have acutely painful conditions, but equally sort of falsely limiting what movement they're doing, and actually sometimes just looking at the type of activity you're doing and not necessarily thinking, oh, well, they can only walk 20 minutes, so that's all we're going to do. Actually, there are lots of other more static activities, or even just playing, 5 minutes, a couple of extra times a day than you normally would. That can actually, on a surface that isn't slippy and where they've warmed up and cooled down, and it's not like playing, running back and forth.
It's just moving.
Free work or gentle movement, or according to, if you think about, there's this whole sort of, puppies should only exercise for 5 minutes per month of age. And that actually, if you look at puppies in general, as long as it's sort of not forced hill walking and really long, actually, it's a bit like children. They'll run around crazily and then be tired and have a rest, and if they're sort of allowed that sort of exploration. But when you see dogs playing together, it's very different than when you see humans exercising with dogs. There'll be sort of lots of turning and running and then periods of sort of calmer sleeping and resting, and sleeping,
panting and catching their breath.
And it's not like we sometimes think, oh well, to keep my dog fit I need to take them on a 5k run. Actually that free exercise that where they're allowed to do the sniffing and playing can be really, really beneficial for them. So how does it impact on the joints? So this is sort of really the nitty gritty of what the how obesity can impact on the joints. So we always sort of think of this mechanical. I've just got another French bulldog here. I should have chosen a different breed, but I quite like this little backpack here on the dog, and it sort of indicates that if your dog is a kilo overweight, think of that, or 2 pounds overweight, think of that as sort of 2 bags of sugar that they're carrying in a backpack that's then putting extra strain on all of their joints.
And it's going to have a bigger impact in little dogs like him.
It's going to have bigger impacts in even though we can't see it as a backpack, that's still that extra weight, and we sort of recognize that, don't we, that it's going to have this extra wear and tear on the joints, and it will reduce their movement. They'll perhaps be less comfortable when they're sleeping, and then they'll move less, and it's sort of that vicious circle. But that's not the only thing that obesity can cause. And even though our dogs are walk on 4 legs, when we actually look at humans, and humans that are higher up on the BMI charts, obesity in people actually has just as much impact on hand osteoarthritis, so wrist osteoarthritis, as it does on knee osteoarthritis. And though it's not like those people are walking around on their hands,
handstands,
that they've got wear and tear in those joints from that. So something else is going on there that's causing the more pain to be felt within their hands and within their wrists than just this mechanical wear and tear. And this is where this fundamental increase in inflammation in fat cells happens. And it used to think, you used to think, well, fat is just sort of an inert substance, and if we put extra calories, it's a storage organ and it's sort of inert. It doesn't really do anything apart from be this sort of extra pressure. But that's actually completely false. We know that at a certain level, and it's difficult to know sort of when this switch flicks to make fat tissue this sort of pro-inflammatory. We'll talk about some of these pro-inflammatory adipokines and what they are. These are all inflammation within signs of inflammation within the body, and this is all what happens in obese tissue, fat tissue, over excess fat tissue in the body.
So when we talk about pro-inflammatory, we're talking about these are making inflammation, as opposed to like our anti-inflammatory medications that we're using that are dumbing it down. These fat cells are producing inflammatory mediators.
That's right. All those mediators that we try and combat with, non-steroidal anti-inflammatories drugs, they're targeting, COX-2, which is to try and be anti-inflammatory. But unfortunately, the fat cells are working against us because they make inflammation worse.
Which is not something you can see, obviously. And actually, if you ever look at a slab of fat, if you like, or if you know a lot of dogs as they get older or a little bit overweight, they've developed these lipomas, like these fatty lumps. I'm sure lots of people have experienced that before. And when you see them, it looks so dull. A bit of fat looks like it wouldn't do anything. Once you take it away, it's probably going to be absolutely fine. But actually, it's producing all of this stuff that you just would not believe just from looking at it, that it was possible to do that.
Yeah, exactly. The slide itself is not mine. I've got this from a design company, but even just looking at this, you can see how sort of angry it is. And some of the major things that are released from the fat tissue, and endocrine is the name of basically a hormone. So just like, hormones are secreted from the pituitary and then go to, around the body to go to the reproductive organs like the ovaries, then to cause ovulation and that sort of thing. There's also endocrines that are produced from fat tissue. And endocrine is just something that is released from one tissue. It travels around the body, usually within the blood, and then it exerts a distant effect on the tissue. And that's what the fat cells produce. And adipose tissue, obviously we're used to talking about, so they're actually known as adipokines because they're endocrine hormones that come from the fat tissue. And one of the major ones I'll talk about is leptin and the effects of leptin on the body and on other tissues and what that does. It's well recognized in humans that leptin is significant, and particularly there's some amazing work done in Cambridge about the tendency for some dogs to be overweight, and there's this particular receptor in the pituitary. So these hormones are actually then feeding back to the pituitary gland, actually to tell the body, when the stomach is full or the fat is basically full. Okay, you don't need to eat anymore. And it feeds back to the pituitary to tell at the level of the POMC gene in the pituitary to say, you're full now, you don't need to eat anymore. And unfortunately, for a lot of Labradors, this POMC gene is faulty. So it is unsurprising with anyone who is a Labrador owner. They really are hungry all the time because that signal that comes from the adipose tissue in their body, that signal basically can't get through to their brain to tell them.
It's not telling them they're full.
So it's not their fault that they're hungry all the time. They actually are hungry all the time. I think this gene fault is recognized in humans, and it's like 0.01% of humans or something have this faulty gene. In Labradors, it's about 20%.
Really?
20%. And Labradors that come from a sort of guide dog background, it's about 40%.
Oh no, that's really 40%. Bad news.
And I mean, there's probably a reason for this. Dogs that are bred from guide dogs are always really, really keen to work for food, to learn tricks, to do stuff, because there might be a biscuit in it for me if I do. Because they're always keen to learn because they're never full. So it's really interesting that these things, and then we've got these then relate to other inflammatory cytokines, tumor necrosis factor alpha, MCP1, that's a good one. What was that? Monocyte chemoattractive protein 1. There we go. That is the mechanism that recruits these macrophages, which are inflammatory cells within the fat. And then you get this, that then releases more inflammatory cytokines like these insulin growth factor, interleukin 1, interleukin 2, interleukin 6, all these different factors there. So that it's a bit like, once it starts, it's a bit of a vicious circle.
Yeah. Just gets out of control, doesn't it?
It gets a bit out of control. Yeah. So, there's lots. We've talked a bit about, the genetics, different things that can, I'll go, obviously this is a human slide. Unfortunately, dogs do live in a pretty similar environment to us. And that's why, they have very similar problems, and you can see, in humans as well, it's well recognized that you unfortunately get this pro-inflammation, you get increased oxidative stress, increased insulin resistance, not so much in dogs, this dysfunctional angiogenesis. This is the risk of heart attack and things like that within the vessels, but that doesn't tend to happen in dogs. But all these other very similar mechanisms going on. Talked about macrophage recruitment in the fat, and then put an even more, busy slide on here.
More sciencey, yeah.
All these different things, fatty liver disease, type 2 diabetes because of the insulin resistance, lots of these different, that's why, overweight dogs will be much more prone to developing this type 2 diabetes. We know overweight dogs are much more at risk of developing not just lipomas, fatty lumps, but lots of other types of cancers, unfortunately. So it's not, the effect that you can have with getting your dog to lose that little bit of extra weight can make a significant difference to their health. They get into this sort of chronic inflammatory state. It's a bit depressing, really, isn't it?
Yeah. Yeah, it is a little bit, because you think, even if I can't do this for the arthritis, if I can't get my dog to lose weight for the arthritis, but I can carry on using all these medications, well, actually the obesity is also having an impact on your liver, and so that might mean that we can't use some medications, so we can't rely just on that. And there's even more reasons keep coming up as to why losing the weight is probably the biggest thing you can do for your older or arthritic dog.
Yeah, absolutely. And I think we'll be moving on to why, it is so difficult.
Yeah.
Leptin, this is the main thing to sort of think about what it actually does. So, sorry, not the pituitary, the hypothalamus. I got carried away with that myself. That's where the POMC gene resides. And that's the sort of appetite center. And so you get this resistance to, this usually leptin is there to help control appetite. But you get this problem where it will actually, interesting, it will sort of increases this energy expenditure. If you've got children, haven't you, Nicki? Have you ever seen them after a party, after they've had a few too many sweets or ice cream? It's like the kids have this, I need to burn off this energy.
A sugar high,
and they get the zoomies, essentially. And that is sort of linked with this. That's what leptin does. It causes this increase in energy expenditure. But often when, there's this miscommunication, that all gets upset. Usually it's there to regulate the function of effects on the pancreas and the intestine, to help with digestion, metabolism of different fats. It does actually have a detrimental effect on cartilage. And it can affect bone mass as well. And it's thought to be involved in the pathogenesis of osteoarthritis itself. It inhibits chondrocytes, are the things that protect the cartilage within the joint, and leptin can inhibit the action of that. So it really does have this actual effect within it's not just it's that extra mechanical. It's actually a chemical effect, a biochemical effect that's going on within the joints that enhances these inflammatory pathways. I've talked about the POMC gene a bit there. Adiponectin is another hormone that can there's contra, some animals it can have different effects, but that's something else that can be released that can have a detrimental effect on cartilage destruction in some species. So it's not as clear cut as the leptin process within dogs. This is still an active area of research.
But if that's not enough reasons to try and lose weight, all of those things.
I know, and you do think, is it even worth it? But I think, going back to what we said right at the beginning, that even just a small amount of weight loss, 5%, you can have significant effect on how much your dog is moving and how comfortable they are. And then once that's happened, it's then much easier because you've already seen those differences and those sacrifices you've had to make in terms of, the bedtime snack or, the burger when you're having, a barbecue, the birthday cake, all those sort of things that you think are a treat and, well, it's only once a year. Actually, you do have to think about all those different things and tackle sort of the whole lifestyle, really. So energy balance, why is it so hard to tackle? Obviously, we know it's all about a balance between calories in and calories out. But weight gain doesn't necessarily happen overnight. Often those calories in, it's you've been feeding what it says on the packet. You haven't been overfeeding them, but for whatever reason, your dog has gained weight. And so
this is a really common one in the consulting room, is that I'm just doing what it says on the packet. And there are two things that I noticed is that one, or that we discussed, which is one, the packet has a guideline, but your dog is very different from another dog that's on that diet. So you can't really,
the other thing is,
it's just a guideline.
There's huge numbers of different reasons why energy balance might be wrong or different than what's in the packet. And I guess the biggest one, there's lots of reasons why your dog's, energy might go up, needs might go up. And this is, when they're growing, whether they're pregnant, if they're lactating. If you've ever had a dog of a dog that's had puppies, when they're producing milk, it's really, really difficult for them to eat enough energy, even if they ate everything they possibly could, eat enough without losing weight. Because it's putting the body through, particularly with sort of 8, 9, 10, 12 puppies, they're taking so much. It takes so much energy to produce all that milk that they need. Obviously exercise can have an impact, but a lot less than we perhaps think, because dogs are really, really efficient at running and walking. We know those people that are sort of constantly moving and never sitting still, and there's dogs like that as well, isn't there? Sort of, whether it's restless leg syndrome or just that, I'm feeling a bit like that now. I can't quite get comfy. Those sort of anxious people, those dogs that someone walks past the window and they're up and barking and what's that going on? And then you get your other dog that sort of might lift its head and then go back to sleep again, and you have to sort of drag them out, and they'll go to the park and lie down and watch all the other dogs running around. They're not
taking them out for an hour exercise
if they don't really need to. But if you've got a dog like that, it's not going to be just going by the packet guidelines. Is going to have a really big difference in what they actually need. And one of the biggest things is neutering. And I'm not saying all dogs, but many dogs that are neutered need on average about 20% less food than they did before.
Which is a lot to suddenly go from one to the next. 20% is a lot.
It's a huge amount. And I think the difficulty is as well that neutering often comes just at the end of their growth phase. When we're neutering less dogs at sort of 5-6 months now, and more at sort of a year or a year and a half. So they're just sort of coming to the end of their growth, and which obviously they need a lot more. And puppies, interestingly, that the Fitbark charts for puppies and exercise are really significant. How much running around a puppy will do, or even a young dog of sort of 8-9 months will do compared to a mature dog of 2-3. They're just coming to the end of that growth. They're going, and then also we're neutering them, so that it's all these things together. Suddenly they need a lot less than they did before. But what's really interesting is that the behavior around food often changes as well, and they've found this. Not only they've done the work they've done at Cambridge, they know that it's Go Dogs. Is the website GODOGS, and the work they've done there shows that it's neutering as well has a fundamental change on the behavior around food, and it's, you know, about this leptin signaling and things like that. It can really alter things, and there's other research to show that, you know, when you take the sex hormones away, they can become a lot more hungry. So all these things together, you know, it's a little bit. And as well, if you had a dog that was maybe, you know, a little bit of a plump puppy, not only do they, when they grow, their fat cells don't just grow, they actually multiply.
Right.
So you've got not only a larger, you've got, you know, a larger number of fat cells that potentially can store more of this fat. So all of these things together, suddenly this dog that was happily running around burning off everything it was eating, all these different factors all coming together all of a sudden, and then suddenly, you know, it's not enough to say, oh, well, I'm feeding the same amount as I was before, but their needs may have changed significantly. You know, we all think about sort of middle-age spread in people, how that's going to change what we need to eat. But obviously dogs can get to sort of middle-aged depending on how big they are, from sort of 5-6 years old. If we think of large breed dogs, they're sort of in their, you know, 40s, 50s.
Feels quite young, doesn't it?
Age of 5 or 6.
Yeah.
So, you know, they take a long time to reach maturity, but they also, you know, start aging, you know, much more quickly than we do. Add to that, you know, maybe an injury, or, oh, well, I can't walk them now for 4 weeks because they've done something to their leg, or, you know, another injury, you know, they've had an eye abscess or an eye ulcer, and so they're wearing a cone, and so they can't go off the lead. And you know, these are the things, medications, you know, they've got skin disease, and so they're having medications, and the steroids are making them really thirsty and really hungry. You know, there's all these different things that our dogs go through, you know, as they're, it might be, you know, a lot of people I work with have got dogs with a lot of training needs. They're maybe a bit more nervous, or, you know, and so they're, you know, to counteract that, to help manage that, they're having lots of different extras and treats. So when they won't work for the kibble, so we need to give them, you know,
high value.
You know, they'll do it if it's a piece of cheese, or, you know, some tasty chicken. And it's sort of all those, it's training, you know, they need it, but it will up these calories, you see, and these sort of hidden calories. They always need a biscuit to get in the car at the end of the walk. Otherwise they go home. Well, you know, sometimes these training rewards are sort of, you know, become sort of habits, and you sort of, you know, he goes and sits by the cupboard, and then we give him a treat. Well, you know, if you give him a treat every time he goes and sits by the cupboard, you're probably going to go and do it again. You know, what gets rewarded gets repeated, as they say in dog training circles. So dogs these days are really, really good at training us. And I guess this moves on to, you know, why, you know, it is so hard to tackle. There's so many.
Your own pets, and your own dog, so hard.
So there's so much choice out there. You just want to give your dog the best, and you want to keep them happy, and you don't necessarily, you know, want to say no. And then you have these eyes looking at you, please, Mom, can I have one more? It's really, really hard.
It's so hard. You want them to love you, don't you? You know,
and you want to show them love. You want them to love you, and you want to show them love. So it's this really difficult combination. We know that there's all these reasons why they need perhaps less food than they did. You know, there's so many food options out there. It's just absolutely baffling sometimes to know which one is best. You know, how much exercise, what type of exercise, how am I going to avoid them, you know, begging all the time? You know, how, if I can't exercise them, you know, they've got an injury, they've got arthritis, I can't exercise them. So, but, you know, or it might be that it's not, you're trying your best, but there's other people in the household, or other people that you take your dog to.
That's a big issue, I think, isn't it? Because you have to get everybody doing it.
Everyone on board. The activity monitors can be really good for spying on, whether it's relatives or whether it's dog walkers or anything else, because my sister's dog went on holiday for a week, and I think it was a friend of theirs were looking after the dog, and I think one day the dog had 5 minutes of activity.
Oh no!
He gained 1 kilo in a week.
Oh no!
He was only a little 10-kilo cavalier. But I think the biggest thing is, will they still love me if I don't give them food anymore, or I don't give them this and I don't give them that? And of course they will.
Yes, I know.
But actually, boundaries, are really, really important. And, you want to be the best pet parent you can be and the best person for your dog. But sometimes actually, getting, knowing that you are going to be doing the best for them by tackling this problem, then, you can rest assured that it is in their long-term best interest. To prioritize it. So, and obviously, is it worth it? You might be thinking, is it really worth it? And as well as the fact that even just a small amount of weight loss can make a really big difference, I thought I haven't worked with these dogs. These are just some nice pictures that I found running around. But there's, these are all comments that I've had from people who I've worked with online over the last a year and a half.
It's just bouncier, runs around more.
Anyone can sort of do it. Your dog will thank you endlessly. It will make a difference to your dog. And I think, the bond that you have with your dog has always been strong. Someone was saying he, after his operation, he relied on us so much, but doing all the extra things that not necessarily is involved with the giving the food, but doing those other things like enrichment and different activities, whether it's hydro or whether it's just different parkour or other things that they can do, different strengthening exercises, massage, all those different things can really help. And if I've done one thing this evening, it's just to hopefully help to identify how important it is weight gain. And often it's like, oh well, my dog's a little bit heavy, but it's not as bad as that dog over there. Actually, when you think about just thinking about what the best is for your dog, often a diet change is part of sometimes needed, but not always. Sometimes, one of the first things I'll often do is just look at the extras and the treats and the rewards and see whether we can swap them for different fruit and vegetables or those sorts of things. I've got a couple of before afters here as well.
Yeah, this is an interesting one. Let's see if anybody notices.
Yeah. So this is Angel before she joined the group. And, she's not significantly overweight. Probably around, you can see a bit of a tuck, but maybe not, a very defined waist. Obviously, this is from the side. You can't particularly, she's got a very shaggy coat as well. So really you need to get your hands in there and feel her ribs. But what the observant ones amongst you might see is that she's actually only got 3 legs. So Alice is much more at risk from developing arthritis, not only in her forelimb, but her hind limbs as well. And so she actually lost that little bit of extra weight to actually become at her ideal weight. It's ideal to have them around 4 out of 9 if they've got arthritis. She's always had a tuck, even when her belly has been barrel-like, but now it's a proper tuck, and I can actually feel the ribs again, they say. So,
it's going to give her a longer life.
One of the biggest things that's going to help her quality of life, because obviously, with only having 3 legs as well, that's and she was active here, but the owner was commented how much more active she was once she'd lost that weight. And this is Ebony, one of the dogs I work with, who I knew from the clinic, but obviously we worked online during lockdown. And this is sort of Ebony before, and you can see she was around 7 out of 9 body condition score. Happy Labrador, happier Labrador here. She she'd had some stifle issues, and I was a bit worried about her elbows as well. But this is her after 12 weeks, and you can see, a little bit more of a tuck developing. She'd lost 3 kilos here at this point.
Yeah.
So, you wouldn't think, where's she hidden all those 3 kilos,
Yeah, but it's interesting, isn't it? Because I think if you saw her in the park, like when you were saying at the beginning, a lot of labs look like this, and so you feel like that's normal. So a lot of people wouldn't have said that she was a 6 or 7 on the body condition score. They would have just said she was normal. So it's really good to point out that, have a really good look, because what you think is normal may not be normal.
And actually, getting your hands in there. Obviously, go to your vets, your veterinary nurses. They'll be able to help you with body condition scoring.
Yeah.
There's videos on my website, so that can help you, identify, we'll go through the knuckle test and what I was talking about before about how to feel the ribs and that sort of thing. And this is a picture of her now. So
now you can really see the difference.
You can see the difference there. From that tuck going in, and there's just, you can actually see that musculature now of her forelimb, which before was just sort of that wasn't very well defined.
Yeah.
So it can be, it can make such a difference. And that's the amazing thing, really, that it's what that little bit of extra work can actually do for dogs. So we know obesity is becoming increasingly more common, but it is, as some of the researchers in canine weight loss, one of the leading experts in Liverpool, it has proven it is one of the single most effective treatments for arthritis, and there are no side effects. And often, if your dog is on medication, sometimes you can reduce the number of medications or the having to delay having to add in something else. It's often not quite enough just to cut. I've stopped giving him this, the beef bone on the weekend, and they only get, one gravy bone now, and a denti stick every other day. It's often not enough. Denti sticks, unfortunately, dental chews are designed to be they're marketed as, you can give one a day. Yeah, you can give one a day, but that's the only other extra you can possibly give per day. Nothing else. And unfortunately, if your dog does need to cut back, that's one of the easiest things to cut back on.
The treats or the dental chews.
You do have to, once your dog is prone to becoming overweight, you do always have to be prepared, because it is something, I think this is where, you can sort of be a bit like, disheartened, it's a lifelong condition, there's nothing we can do. But actually, I will reassure you that there is things you can do, and a lot of these horrible, pro-inflammatory markers, the indicators, they are reversible. So if we get rid of this extra, it's not like they're going to be there forever. No. That's what makes the biggest difference. If you can get them down to a slimmer body condition, then all those horrible inflammatory cells that were there go back to normal. It is unfortunately very well recognized. So I think, again, with weight control, we need to be thinking about it much, much earlier on, rather than waiting until it's much harder as well to get dogs to lose weight when they're in their older years. They're already at risk of losing, muscle mass and that sort of thing. You choosing an inappropriate diet with not high enough levels of protein can make that more at risk of developing their muscle, losing their muscles, particularly if we're not doing strengthening exercises to help maintain them. It's managing weight is a priority, really. You should make it a priority to reduce your dog's risk of developing and worsening arthritis and the associated cost of treatment. So if you control the weight right from the beginning,
then you are, I'm going to pop you back on the screen now. You control their weight right from puppyhood into when they get neutered. You're saving yourselves this battle when they reach 6, 7, 8, where you realize, oh, now we have to lose the weight. I mean, it's the same as people, isn't it? Have a healthy start.
It is, yeah.
Healthy nutrition, and hopefully you won't get in that situation. And there's an interesting question here from Elizabeth. It says, my 2 self-regulating dogs eat way less on hot days and when they don't walk as far. Great, fantastic. Probably not Labradors. The other 2 fall in the bowl and inhale whatever. So less easy to regulate their food intake. Should I be varying their food ration daily? Because on hot days, I guess they're not going to be doing the same amount of exercise.
Yeah, so I think if your dog is some dogs are sort of, well, you know, tend to be sort of self-regulating, won't they? They might only want to have 1 meal a day.
Yeah.
But interestingly, there was a paper that showed that if you fed your dog more than once a day, they were more likely to be overweight.
Really?
Yeah, but actually, ironically, if your dog is overweight, then it's actually easier to get them to lose weight if you feed them more often than once a day.
Right.
So
Okay.
it's sort of, you know, a bit contradictory.
Which I think makes sense in my mind, because you don't want them to have a long period of time.
There is a slight, if you're breaking the food down, there's energy involved with switching on the digestion.
Yeah.
So there's this energy that and actually energy you use to break down the food. So if you only do that once a day, you only have to sort of turn that switch on once a day.
Yeah.
Whereas if you actually feed them 3 times a day, obviously smaller amounts and total calorie intake smaller, then there's an argument to say actually you'll turn on, it takes quite a lot of energy to turn on these digestive enzymes and that to work. So there's a heat generated from that food breakdown, and that will actually burn off some extra calories. So in answer to the question, do you vary it per day? I think if your dog is regulating, I would just say it's a bit like us if we're going to the gym and thinking, oh, I did a really good session there, I've earned my miles.
Yeah.
Actually, you know, when you think about what you've done and what you've earned calorie wise, you'll always overestimate what you've actually done.
Yeah.
So actually keeping, you know, the food intake the same. If they've done a particularly, you know, you normally walk for an hour in the morning, an hour at night, and they've been out for 5 hours because, you know, you went here and then you went in, you know, obviously not on a really hot day, I'd be worried. But if you're doing that, then actually, you know, giving them extra. In fact, I'd almost think it the other way. If you do go to a barbecue and, you know, your neighbour has given them a sausage and then they've been hoovering up, actually do it the other way. If they have had those extras, think about that and take away a proportion of their food that they've had that day, and then the rest of the time, you know, they'll make up for it. And often when we're thinking about food intake, we often need to reduce the food quite a lot more significantly than we think we do, because often they've been having that only slightly more, and they've only been putting on a little bit of weight, you know, maybe half a kilo every year or a kilo every year. You know, you might reduce the food, and great, you then get them at calorie balance, so they're not putting any weight on, they're not putting any weight off,
but they're maintaining it.
And they're maintaining it. So actually what we need to do for dogs that are overweight, we need to actually reduce that down a little bit further so that they actually can lose the weight.
I
think that's the step that gets to be a bit scary when we're going, oh, but we're feeding, you know, 80% less than it says on the packet. And maybe that's when those low calorie or maintenance diets is not going to be quite enough to reduce the calorie content further, particularly if your dog is having that kibble plus having, oh, well, they have, you know, this other wet food, you know, a couple of times a week when they're at, you know,
Granny's house or
you know,
and then I think it's really hard because a lot of people now work from home, so they're having their lunch at home, and maybe a dog that didn't used to have a little lunch, they just had their twice a day meals, they're getting something because we do we want our dog to experience the same lifestyle as us. So we feel like they need that. I mean, I do it if I work from home. They get, or she gets.
Well, sometimes it's good,
something.
they have an extra call or something because you're on a meeting and an online meeting, and you can't have the dog barking, and then suddenly that becomes a daily habit.
Yeah.
And then before you know it, it's they can't go without it even on the weekend.
Yeah.
And
you see how easily it happens.
Really easy. And obviously, lockdown has a lot to blame because it's changed a lot of people's habits. Okay, some people started, we can go out for an hour a day. Oh, who knew you had to walk for an hour a day?
That's true as well.
People actually did more exercise. But a huge number of people got into the habit of doing a lot less.
Yes.
And sometimes doing something a bit different with your dog, and maybe trying a new sport, or if agility isn't your thing, you can try hoopers, or scent work or free work, or even just on a Tuesday night we're going to go to a different forest, and find a new park, a new sense, or even just in the local area, just somewhere new to go and let them have a wander and a sniff. Or find a canal, or that they're normally quite flat and long. So sometimes if it's quite a good, we'll get this far this week, and then next week we'll go that little bit further, and that can be, your dog suddenly, knows. Obviously, hydro, we think of sort of in a controlled environment, but if your dog, if there's a safe stream you can go to and they keep wading, that's still really good, resistance exercise. Through long grass, that can be a really good resistance exercise that you can do, that isn't necessarily hugely impactful on their joints, but it's sort of adding to what you can do. And often if they've, a lot of the time we think about, they're going to need this medication and this control after a surgery, but we don't necessarily think about the sort of nutrition side of things.
No.
Actually, after they've had surgery, we almost tend to go the other way and spoil them a little bit with, we need to give them a really easy to digest food after the operation. But instead of giving that for 2 or 3 days, that ends up being 2 or 3 weeks.
Yeah.
And that actually might be, sometimes wet food within the whole piece can be quite useful because it can add, textures. You can use it in different enrichment toys. I think a word of warning, if you are getting enrichment toys, it's not necessarily best to use make them yourself, because then, under supervision, because then you can change them regularly rather than just thinking, we'll just use the Kong again.
Yeah, because if you're thinking about, so post-op, like if you've got a dog that's 2 weeks, then maybe you are going to use the same thing every day. But if you've got an arthritic dog where you need to be doing it on a daily basis ongoing, that's a really good point. Change it up, make it interesting, use different things. Yeah. So I think there's some ideas on your website.
Out with you to somewhere, rather than just giving it in the living room. That makes it all the more exciting for a dog. You can freeze it on a hot day, so that it will last longer.
Just keep changing it. We've got a message just coming here from Kay. Really struggling with my border collie. She had a TPLO 5 weeks ago, and she has lost 3 kilograms in 3 months now, but she's looking for food a lot more now. She's starting to be more active. I'm doing enrichment work with her, but can you recommend alternative strategies to distract her?
So a lot of the time we sort of think, we feed our dogs from a bowl. And then we give them their food, and then we're quite happy when they finish their bowl and they've had their dinner now, that's good. Whereas actually, if you think about it from a dog's point of view, I mean, there's sometimes these feeding bowls you can give, and actually even some of the weight loss foods, they actually design the kibble into a different shape so that it takes the dog slightly longer. I remember watching the dog, and the normal kibble they finished in about 20 seconds, and the weight loss kibble they finished in about 1 minute 40.
Really? That's different.
Yeah, that different, which is like, that's amazing. But actually that's still, 23 hours and 58 minutes that the dog is, what am I going to do now? So actually feeding, not necessarily using that kibble that you've got, but not, and a lot of dog trainers do this as a routine with their young dogs and with their puppies. They don't necessarily feed the dog from a bowl.
No.
They feed the dog while they're on a walk, or, oh, well, we're doing the washing now and you're sitting, that's a good boy, and or I'm brushing up the leaves and, oh, you're not interfering with the brush, and they give it then, and they give that food, and whether it's kibble or obviously it's a bit more difficult with wet foods that you give it. But you give that as you go along. So that can be, you know, not necessarily thinking, and it might be that you don't do that every day, because you don't necessarily have time to do it every day.
No.
Lives. But even if it's 1 or 2 meals a week, just, okay, they're not going to have tea. They are going to have that food, but I'm going to play hide and seek in the evening, or even just chucking it out into the garden and scatter feeding, you know, creating a mini obstacle course. There's some amazing work with, I think it's Sarah Fisher who
we've had her on.
Free, oh, have you?
And
so she does free work, and that can be really, and it's sometimes, you know, we sort of think we have to do that enrichment, or we have to think of, oh, what thing can I create, what, you know, what food bowl can I create that looks all pretty in all different colors of the rainbow.
You don't need anything like that. And
actually just 5 minutes setting up in the garden with a couple of plant pots and, you know, some other, you know, surface to stand on, a rug and a coat, or, you know, and other things, you know, they have to finally go underneath. And obviously when you start off doing things, you sort of want to make it easy enough that the dog can find the things,
achieve it.
But then as you go through, you can make it that little bit more difficult, because you don't want to, you know, avoid, you know, lead into frustration.
No.
But equally, that can actually, you know, when you do a little bit of free work, and you can actually then see, there's a lady in the group who's come to talk to me about free work, and she looks after dogs as well. And so, you know, the one of her owners was like, what did you do with Frankie? He was exhausted when he got home. And it was just because he was doing all that brain work. With, you know, to us it seems simple, but often the food that you're giving, and that's why I say, you know, don't just think of enrichment as an enrichment toy. Oh, done, ticking box, right? They've been enriched for today. It's an ongoing process, and, you know, to make things, you know, different and you know, vary it
every day is different.
Day, or not necessarily every day, but every week you do something slightly different. Or, you know, there might be some things they really like doing. You know, if they're really into digging, you know, getting a parcel box with paper scrunched up and putting the kibble in there, that can be really good. You know, 5 and often they'll be not just using their nose, but they'll be using their front legs as well, which can be, you know, help with, you know, they'll be leaning down and they're not just using their front legs, but they're using their core and using their body. So
and hopefully with your collie Kay at 5 weeks post-op, then, you know, even having stuff at head height would be suitable for her to do. So that would be good.
At that sort of stage, it might be, you know, that you could start some hydrotherapy as well.
Yeah, potentially. Yeah. Do some extra bits. One thing that you sort of touched on a little bit, just a point from Lynn here, is that keeping an eye on unexplained weight gain can be really important, because it might not be that it's your fault. And with her dog, knowing that she hadn't had more food, but she was putting on the weight, meant that they could identify that she had hypothyroidism, which is another reason why dogs might put on weight.
I didn't particularly mention hormone diseases, but that can be a cause of weight gain. A lot of people will say, oh, well, you know, my dog has got thyroid disease, and it is actually a lot rarer. And then we think 60% of dogs are overweight, about 1% of dogs have hypothyroidism. So, you know, he's got that. It can be there. It's really useful, particularly if your dog is more senior, to rule out hypothyroid disease, because if it is, it's not always a simple diagnosis. Actually,
no,
it's just not just one blood test, but there's definitely it's worth ruling out.
Yeah.
But very often you still need, even when they have got hypothyroid disease, even on
Need weight
treatment, you
management.
sometimes still need a calorie controlled diet as well as other exercises. But yeah definitely, I'm glad that was brought up.
And then we've got another one from Hannah here. It says, do you know if there's a sex difference in the effects of neutering? Is it equal across sexes, or is one sex at greater risk of weight gain after neutering?
It's thought to be that there is a slightly greater risk. A lot of people would think it might be the boys, but it's actually the female dogs who tend to be at greater risk from weight gain after spaying. And it is difficult, because you sort of think, oh well, it's a preventative procedure. Do we really need to do it? Can I just keep them entire? But obviously we know there's lots of diseases that can be caused by not being neutered in dogs. Pyometra, can kill dogs. Much higher risk of mammary tumors. There's obviously their risk of obesity goes up, but really not because of the spaying per se. It's because we haven't tackled those, the actual calories in and things like that.
Yeah. And it's manageable as long as you're aware and looking for it. It's manageable.
Yeah, it is. And it's actually more the risk of being overweight goes up in female dogs more than in male dogs. And there's certain breeds as well that are going to be more at risk anyway from becoming overweight. It's often the dogs about, Labradors, flat coat retrievers, beagles, pugs.
Ones you see on a daily basis.
But actually sometimes Springer Spaniels, collies, they can have a higher risk. So if you think you have got one of those breeds, or you just think you've got an inkling that your dog is just a little bit more sedentary than maybe other dogs that you see, be aware of that and actually choose a low calorie food, or one that's slightly higher fiber, to actually help manage it before it becomes a problem.
Charlene's just written about, have we got links to these? And I think there's some good links on your website, aren't there, from your blogs about some of the things?
There are. So probably the best, in terms of what we talked about tonight, there are some links on there. I've actually done a blog a week or so ago about fat and inflammation, and actually talked about slightly different things on there than what we talked about tonight. But there is some more links on there about what we've been discussing. So you can just go to www.theslimvet.co.uk and then /blog, and then that will be there.
I'll put them on there. I will go through these as well later and make sure I haven't missed anything. But I can see
to answer questions later anyway. I can go.
Thank you. I can email you or forward them on to you. So thank you. Oh, Hannah's just written someone else. It's very interesting. I find it much, much harder to keep weight off my spayed female than my neutered male. Yeah, she's significantly more active than him and yet needs a hugely restricted diet whilst he can eat 3 times the amount. Yeah,
it's they're all different, you see, and that's why the guide on the bag, there's often a really big range anyway. But often it's and a lot of people say, oh well, the food companies are obviously saying you need to feed more because they want to give you more food. But actually they have to put the amount for a non-neutered dog on the bag, because they can't be seen to be underfeeding then 20-30% of the dogs. So that's why you almost have to then knock that back yourself. But equally it is tricky, because some foods are balanced according to this calorie amount, and if you underfeed significantly by 80% of what or you're feeding 20% less than it says on the bag, then you can be at risk of not underfeeding your dog in terms of the nutrient, the main nutrients,
calories.
unless maybe even the protein sometimes, but the micronutrients, and it's not really enough to just say, oh well, I'll give a supplement. You need to find a food that is going to be suitable, that will, and that's where the prescription diets can come in. If you're having to, and even just feeding those for a period of time to get them to the ideal or a target weight, and then going back to a weight maintenance diet after that is usually fine.
Yeah. Margaret's just said we haven't answered her question, which was up here. I think this might be more. I'm going to put a link to a live we did with Charlie Gray about omega-3s for you here, Margaret, because I think this might be more of a nutritionist side of things. Would you agree? For 18 months, I haven't been able to get the joint food recommended by the vet. So can you tell me how much fish is a safe amount per week so I can add some omega-3s?
That is really interesting question. It is something that you do have to be careful of, because even if you're adding, and I think we didn't really touch on it particularly, but with supplements, or particularly with omega-3s, it's a bit of a trade-off. And I completely agree with her that it's much better if we can get a food that has that already in. And even though you can't get that food that it's got in, a lot of the foods now that are available have these higher levels of DHA and EPA already in the food, and then that's factored in to the calorie amount. Whereas if you're giving if you're giving an oil supplement, often that's sort of 20-30 calories per teaspoon, which you wouldn't think is that much, but bearing in mind a lot of dogs maybe need 60 or 70 calories of treats per day. With that tiny oil supplement, can you give some oily fish? We think it's probably you get a better, absorption of the oily, the omega-3s and the omega-6s if you're giving it in food rather than just as a supplement. But unfortunately, if you're giving, oily fish, then it is often quite high in calorie as well. So you do have to just be careful, and maybe doing that, once a week is going to be better than giving it every day. And then working that out and then taking off, that amount of food as
on those days,
as giving, a slightly lower number of treats. Often with treats, I'll recommend giving, vegetables and fruits and vegetables, maybe slightly cooked, which will have a lower calorie and often quite high in water content as the treat portion, rather than just concentrate on the food.
But it is hopefully you'll be able to get hold of a joint food. There are a few out there, so and some of them have moderate calorie or low calorie versions as well, so I
can forward on a link for showing how much of which and even the different foods have different levels of omega-3s in. So, having a look at that can be useful. I've got
that would be good if you could do that. And then I will also put the link to Charlie's live for you to have a look there as well, Margaret. So I'm going to bring it to an end, just because I can see I didn't realise how long we've been chatting for. It's almost an hour and a half. So thank you so much, Caroline, for coming on and sharing all that. It's been really interesting, and I think everyone's
so much for having me. Been a pleasure. I don't know where the time goes.
I know. It always happens.
And I wonder where I've got to.
And if anyone does want some more information or feels like this could be beneficial for them and wants some help, then I'm going to put the link to your website in the blurb and your Facebook page as well. What you said, the canine, the Facebook page.
Slimline Canine.
Slimline Canine.
And then
I'm going to put that in there
really
as well.
Friendly group. Come and join us.
So I will put all those in afterwards. And if you have any other questions, pop them down. I'll try and have a look over the next couple of days and ask Caroline if it's something that she can help us with. But thank you so much for joining
you're very welcome. If anyone wants a bit of a kickstart, I'm doing a little workshop at the end of June, July. So come and join us. It's over a weekend, so no excuses.
No, join. I'll put a link to that as well.
Thank you.
So have a lovely evening, everybody, and we'll see you again next week.
Bye.